Hello and thank you for watching today. My next discussion, I'd like to talk about the Tumescent Liposuction technique. This is a technique that we use here at MyShape Lipo for removing the fat. The Tumescent technique is a technique that was developed in the 80s by Dr. Jeffrey Klein in Southern California. This technique has really revolutionized liposuction as we know it and allowed for a significantly safer procedure as well as quicker recovery, and more importantly for our purposes, it has allowed us to do this whole procedure under local anesthetic while you're awake. Some of the advantages of the Tumescent technique is, first, it allows us to do it under local anesthetic, so there is no general anesthesia, which completely eliminates all the risk factors of general anesthesia and as well as the cost, and allows us to do this procedure in an office-based setting as opposed to a hospital. Again, eliminates cost. Now, one of the downsides you should know about with general anesthesia is one of the biggest risks of pretty much any surgery that's done. General anesthesia, what really happens is they put you to sleep, and with the medication that's used called propofol, this is the same medication that Michael Jackson died from. This medication actually stops you from breathing. So yes, it puts you to sleep, but it also stops you from breathing, requiring a tube to be put down your throat by an anesthesiologist, and then we can breathe for you. Now, obviously, if there's any complications or errors with mechanical equipment, this could be a devastating tragedy to not be able to breathe during surgery. So again, this is a huge risk. With Tumescent technique, we can completely eliminate the risk factors for general anesthesia. The solution that we use for the Tumescent technique, and basically the Tumescent techniques is injecting this fluid into the fat layer, and the fluid refers to saline, which is simply salt water, lidocaine, which is the numbing medication, epinephrine, which is the medication that constricts the blood vessels so it makes for very little bleeding, essentially pushes the blood away from the area, in which you may see in some of our pictures that the skin has turned white in the area that we treated, and that's because of the epinephrine. It essentially pushes all the blood away from the area, making it for very little blood loss during the procedure, with less blood loss during the procedure, less blood loss after the procedure, less bruising, and a quicker recovery. So the way this works is the first part of the procedure is getting you numb, so we'll be injecting this tumescent fluid into the fat layer. So we make these tiny little puncture holes, 2 millimeters in size, and these are my access points. So I'm going to be passing my instrument under the skin, and I can spray this tumescent fluid into the fat layer. It essentially swells up the fat layer. It gets you numb and constricts those blood vessels so we make for less bleeding. One of the big benefits that I have found with the Tumescent technique is, for one, it's really good at getting people numb and keeping them comfortable during the procedure. The nice thing about the lack of blood in the area is there's very little blood that's removed during liposuction, which in the past, before the Tumescent technique, people would lose a lot of blood and require transfusions regularly. And cross my fingers, with 15,000 procedures, we have not required one transfusion at this point, so that's good. Another thing that's nice with the Tumescent technique is the fat layer is the only part that is numbed. The muscle layer is not numbed, so while this may sound bad that if we go too deep with our instruments, you'll feel it if we hit the muscle, but that's actually protecting you, because if we go too deep and hit the muscle, you don't want to hit the muscle. And more importantly, we don't want to go through the muscle and get to the internal organs. That's where your bad problems happen. So the fact that the patient can feel their muscles is a control barrier and stops us from going too deep and stop us from causing major problems that could potentially kill you. Don't want that. So the nice thing about the Tumescent technique is only the fat layer is numb, so if I did dive down a little bit too deep and get close to the muscle, you're going to feel that stopping me way before we ever got to any anywhere close to the internal organs. So this is a safety barrier that's very important for the tumescent technique. Any further questions regarding tumescent technique, please give us a call at our office, 702-818-5476. Thank you very much.